all-on-4 implant treatment last forever?
Implants can last forever in some people. The important key factors are that they're done well, that you're in good general health, and that you look after them very well. Keeping those things in mind, I always tell people that there is no treatment in the world that ever has a 100% success rate. No surgery ever has a 100% success rate. Cheap surgery, expensive surgery, covered by Medicare, if you have to pay for it out of pocket, your body doesn't care. How it's done is important. Are the implants in the right positions? Good implants used? How skilled is the surgeon doing the treatment? These are all really important factors. The technicians have to be skilled. The technicians make your teeth that fit on top of implants, making them strong, making them fit well, relieving the unnecessary forces, making sure the bite is good. So these are all really important factors that do contribute to long-term successes. Having said that, we still don't know a lot about implants. And if there is any treatment, any dental treatment out there that carries the highest risk of failure, it's actually full mouth implants or all-on-4 implants, which is the same thing. But we're still learning about them. So I say to people that if you don't need them, don't do them. Your teeth are still better than implants. But if you have to have them, to go from no teeth to implants is incredible. But they have to be done well, and you really have to look very well after them at home. And I'll talk a little bit about that later.
What are the most common complications of all-on-4 implant treatment?
There are many possible complications. A lot of them don't happen, but sometimes some complications do happen, to be expected with any treatment. So I think of complications in probably 3 phases. The immediate complications, which can happen straight after the surgery. The post-surgical complications, maybe after 2 weeks. And the delayed complications years down the track. So firstly, let's talk about immediate complications. Bruising, swelling, a little bit of pain in the mouth. Infections can happen. So bruising, swelling, pain, very easily managed with painkillers. Very few people complain of post-operative pain when they come to see us, because we prescribe a number of anti-inflammatory medications and painkillers. Infection is a common complication. Infection can cause implant failure, bone graft failure. It's our worst enemy. We really try to prevent post-operative infections by prescribing new antibiotics. So people can get infections even while they're taking antibiotics, but the risk is significantly reduced. And we generally recommend to start taking antibiotics a day before your surgery. Complications that can happen after 2 weeks or in the first few months after your surgery while you're healing, sometimes implants don't take. Implants don't take possibly because you're not in good health. That's one reason. Another reason, your vitamin D levels are low. So it is advisable to check your vitamin D levels before you undergo any implant surgery. We do know that healing and integration of implants is dependent on good levels of vitamin D. There are also complications with immediate teeth. They are not as strong as your final ones. Sometimes they can chip, sometimes they can break. Sometimes they don't look as good as you want them to look. I wouldn't say that's a complication, although you might see it as a complication. We can address those matters with the final prosthesis or the final teeth. Now, the long-term complications, there are also some common ones. Implants developing a condition that's called peri-implantitis. It's a form of infection associated with implants. We don't have very good treatments for this complication. It's best to prevent it rather than treat it. Your dentist will show you how to look after your implants, how to floss around them. That is the most important thing that you can do to influence the outcome of your implants long term. The way you clean them. Each implant needs to be flossed for about 3 to 6 seconds a day. It's not a huge commitment, but it will significantly improve long-term success of the implants. So peri-implantitis. Now, peri-implantitis is also dependent on how well your implant was placed. The experience of your surgeon is also important. Another common complication with full mouth implants, such as all-in-4, is your teeth breaking. Sometimes one of the teeth can come off. It is common. Sometimes the whole prosthesis or the whole bridge can break. In some situations, they can easily be repaired. In other situations, the whole bridge needs to be remade. The important thing is to understand why a failure has occurred, and this is up to us, up to the dentist and the technician to troubleshoot. It could be that you are grinding at night in your sleep, in which case it is really important to wear a protective grinding plate called the occlusal splint at night in your sleep. If your dentist has recommended that to you and you don't wear that, then the chances of bridge failures is very high. If you do wear it, then you're significantly minimizing this. Another thing that can happen, these are minor things, teeth can stain over time. They don't last forever. They can stain maybe in 5, 6, 10 years. They might need to be replaced when they wear down. That's not a complication, that's a normal occurrence with bridges. Another difficult complication that can happen is failure of components that connect your new teeth to implants. They're generally connected with little tiny screws. Those screws can fracture. They can fracture as a result of long-term use. They can fracture as a result of your mouth changing over time. They can also fracture if you grind your teeth at night. So again, I can't stress enough how important it is to wear a protective occlusal splint at night in your sleep if you grind your teeth at night. These treatments are not perfect. They do carry higher risk rates than other treatments in dentistry. So lots of factors are important. Having it done by an experienced practitioner and looking after them are very, very important factors.
What can I do to take care of my implants and avoid complications?
Taking care of implants is very simple. Floss them. You have to floss each implant for 6 seconds a day. If you can imagine, an implant is a cylinder. So you have to remove plaque from half of this cylinder here on this side and half on this side. So you have to floss it like that and like that every day for 6 seconds. How difficult is that? If you do that, you minimize the risk of peri-implantitis, which is infection around implants, and you significantly improve success rates.